Each year, the number of people living with HIV makes headlines. But here's something you can do to fight the epidemic. Offer each of your patients the opportunity to take an HIV test. It's easy, accurate, and in some cases, you can have results in less than 20 minutes.
There's so many people living with HIV and don't even know it. And they're unknowingly spreading this illness to others. And so we need the medical team, the clerks, the nurses, everybody to work with us to reassure a patient that getting tested is normal, it's painless, it's informative, and we can immediately link them up to care if they need it. If you care about yourself, if you care about your partner, if you care about your family or your community, at the very least, you would know your own HIV status.
What are the facts about HIV screening in healthcare clinics and emergency rooms?
Patients don't even want an HIV test when they come into a clinic or ER.
Studies have shown that patients are 90% in favor of HIV testing in a clinic or ER setting.
Testing everyone could slow down my patient turnover and increase waiting times.
There is no evidence that offering HIV screening has any impact on patient flow or length of stay. A large study recently showed no change in any of these parameters.
HIV screening will lead to dozens of HIV-positive patients being identified. We just don't have the ability to handle all these new cases.
Even in high-prevalence areas, the rate of new infections is between 1% and 3%, or about 2 new cases per week. This caseload can be accommodated by nearly all facilities.
Honey, what are you talking about? Doctors and clinicians aren't even trained to deliver an HIV diagnosis.
And as physicians, we're trained how to give people news. We tell people they have cancer, we tell people they have diabetes. So we know how to give people news and how to counsel around it. HIV really should fit into that as well. It's not a death sentence, it's something that we have treatment available for.
Physicians and clinicians are experts in communicating with patients. Of course, learning what to say to a patient when they have a preliminary positive test may be a new skill that you will need to acquire, but it's an easy process to learn. This HIV-positive patient is living a healthy life because he was offered an HIV test at his healthcare facility.
Being able to come here every few months to check in and know that my status is undetectable, it makes me feel better to know that it's not a death sentence. I feel free, not having that nagging worry of, is there something going on in my body that I don't want to talk to people about? It's kind of out and open, and treatment is, it's been great.
In the U.S., there are approximately 50,000 new HIV infections every year. Today, over 1 million people have HIV. Of these, 250,000 don't know they are infected. In 2006, the CDC recommended routine HIV screening in all healthcare settings. Numerous medical associations, including the Society for Academic Emergency Medicine and the American College of Emergency Physicians, have endorsed this recommendation. HIV tests come in several forms. Some require a blood sample, while others are a simple swab of the gums. And results can be ready quickly. For the rapid HIV test, results in less than 20 minutes. All HIV screening tests require a confirmatory test before the diagnosis of HIV infection can be made with certainty.
Ms. Denton, I have your test results. The HIV test came back and it was all good news.
These tests have a sensitivity of over 99%, with only about 4 false positives for every 1,000 tests done.
Are there any questions that you may have?
No, that would be all.
Well, wonderful. Maybe I'll see you in a couple months?
Sure.
Great.
Thank you.
We think it's important to offer it to everyone. We're not singling you out because of a certain risk factor, but we're saying we recommend it for everyone. So if you refuse it, then you're opting out of the test. Otherwise, the test will be done.
To recap, HIV screening is recommended for patients in all healthcare settings after the patient is notified that testing will be performed unless the patient declines. This is called opt-out screening. Persons at high risk for HIV infection should be screened for HIV at least annually. separate written consent for HIV testing should not be required. General consent for medical care should be considered sufficient to encompass consent for HIV testing. Prevention counseling should not be required with HIV diagnostic testing or as part of HIV screening programs in healthcare settings. For more information, visit cdc.gov/HIV.